fronts. I think it's helpful to frame this conversation about reopening by looking at what Governor Baker has shared yesterday, which was their 4-phased approach to reopening. That starts with a limited number of industries resuming their operations with the most restrictive policies in place, and then gradually expanding to include other industries and gradually reducing restrictions as appropriate for the community and as the data tells us we can do. Moving through these phases is going to be dependent on a continued positive outlook on the data that we're seeing from the public health perspective. And I know Dr. Kong will touch on this in her remarks, but I don't want to sugarcoat it. Based on the information that we've been provided by the state and by public health officials, we all know that this is going to be a painfully slow process. And in order for us to avoid another shutdown, this is going to have to be a slow process. And we're going to have to get very comfortable with doing things like wearing masks, doing things like socially distancing. And it is going to present, unfortunately, a new normal for us, not only in the city of Revere, but across the entire Commonwealth and across the country. We've convened in the city of Revere, we've convened a team to work on these transition plans for the city. The Revere reopening team will be informed by guidance from the state, and we're getting an awful lot of ideas and kind of guidance from the state, but it'll be customized to our policies and our strategies as a local community and what really works for us. Looking to our businesses and our operators to provide us with some insight, some of the knowledge that they have on the ground level, and the support that they'll need to be able to responsibly reopen in the city of Revere. And the idea behind having a reopening team will be that they will actually do the outreach to our stakeholders. We actually have a forum lined up, a business forum lined up for tomorrow, and another one on Thursday at 3:30. Tomorrow's forum will be in English and Thursdays will be in Spanish. And I'd encourage any of the local businesses or anybody interested in the local business community to make sure that you register for that forum. And that'll be the official start of the dialogue that we will continue to have. And that will be followed by a series of listening sessions that will be specific to certain industries that we have in the city of Revere. Another topic that I want people to know that we're thinking about and that we're planning for is how to continue to engage and support our youth. We know that obviously with the shortened school year and now the onset of what will be summer, this can be a difficult time. And so we have a separate team that is working hard to come up with some plans around engaging our young people and make sure that we have some meaningful summer programming. And we will be getting those details out as soon as possible. And I know Dr. Kelly and her team are starting to look at and be thinking about what it looks like to reopen in the fall and have our schools reopen in the fall. It's something that I know that the governor has expressed to me is important and something that they're committed to at the state level to make sure that schools are open in the fall. And we know that when our students pick back up, we want to make sure that it's under the best possible conditions. Through all of this, contact tracing has continued to be an integral and really incredibly important part of our strategy. You've probably heard about some of the great work that our nurses have done in the city of Revere and that they continue to do to make sure that we're reaching every single person who has either been confirmed or has been in touch with a confirmed COVID-19 positive individual. And through the work that they've done, they've been able to provide additional access and make sure that people know about the access to testing and other supports that we have provided to the residents. Before I turn it over to Dr. Kong, I want to thank all of the residents and everyone who's tuning in tonight for the sacrifices that they're all making and to get us to a place where we are today. I know that each and every one of you, we've talked about and we've asked each and every one of you to do your part. And you have the trends that we're seeing in terms of numbers is good. I'm gonna knock on wood first, and then I'm gonna say that we're not gonna rest on that and just think that everything's gonna be fine. But the data that we get each and every day is starting to trend in the way that we want it to, and that is good news. But we have to continue to be vigilant. We have to continue to be smart about limiting our exposure to each other, to continue to socially distance, and to continue to wear masks. And especially if we want to continue to move in this right direction. I want to finally thank everyone for everything that they've done for one another, and sometimes the smallest ways and sometimes very big ways to help each other over the past several weeks. I continue to be incredibly proud to be the mayor of a city with such great people. And it really has been, a situation that has seen so many people step up in so many different ways. And we have so many people that care about each other and care about being part of the solution. And I want to thank them for all the great work that they've done. With that, I'll turn it over to Dr. Kong, and then we'll hear from Kate as well. So thanks again. Dr. Kong, thank you again for taking the time to be with us.
Good evening, everyone. And thank you, as always, Mayor Arrigo, for having me on. I'm going to start by trying to, Ruben, if you can put my slides up for me, please. I wanted to jump off of what the mayor had just said about our numbers looking great, and I want to share that with everyone in some slides I have.
All right, hang on.
No problem.
This is that awkward time when you can't even talk about the Red Sox or anything. Maybe the weather a little bit. Okay, we're back. We're back.
We're back. All right. So thanks for being patient with me, everyone. So as you can see here, our numbers are looking amazing. We're having a drastic reduction in the number of new cases every day. And that's not only reflected in the Revere data that I have posted here, but it is also reflected in the data for the entire state of Massachusetts. So just to kind of echo what the mayor said, we are seeing a reduction in the number of cases. So this is all the proof you need to know that all of your efforts for staying at home, for staying socially distant, for wearing masks, for practicing good hand hygiene, it's all working, and it's all leading to less people getting the virus, and as a result, less people dying from the virus. So kudos to everyone who has been part of the solution. Next slide, please, Ruben. As Mayor Arrigo alluded to yesterday, the governor released a very broad framework on how we as a state will be reopening our businesses and communities. Revere will obviously be convening its own separate working group and listening group to make sure that we are opening in a way that is productive for all members of our community. But I wanted to kind of touch upon this plan because I do like the overall framework. Right now, obviously, we're in the red zone, currently staying at home, but that's set to expire in less than a week on May 18th. During this first phase and on to phase 2 and 3, we're slowly, and I want to emphasize the word slowly, going to start to allow certain sectors or certain industries to resume operations. But that's going to be under the guise of severe restrictions. One of them might be limiting their capacities, for example, capacities in restaurants. Another might be to have more hand washing stations, things like that. But we do want to make sure that people and our lives can start to move forward. We want people to go back to work. We want everyone's jobs and businesses to start to thrive again. So we're going to take a very measured approach. And in phase 1, we'll have some industries. And if the numbers look good, we'll go on to phase 2 and have more industries open. And if the numbers continue to look good, we'll go on to phase 3 and have yet more industries open. Until finally we reach phase 4, which is when we've developed new definitive treatments for the coronavirus, and most importantly, vaccines against the coronavirus. I think that will really enable us as a community, as a society, as a country to really move on with our lives and kind of come to a new normal and be able to kind of enjoy the things we used to enjoy, like sports or the beach. The things that we're really going to focus on that will tell us when we can open these businesses, when we can move to phase 2 to allow more businesses to open, is a couple of things. And that is what I already showed you. The first being our number of new cases per day. Are we continuing to see a decline? Are we maybe staying stable with the same numbers every day? Or are we moving in the wrong direction? And that is, are we spiking up to 100 cases, 200, 300 cases a day? We want to know what's actually happening to our community, to our patients. Another thing that the DPH is keeping close track on are how many patients are currently admitted to the hospital. How many are in the ICUs right now, and how many are still being ventilated? Because when you start to reopen businesses, when you start to go about life in a close to normal fashion, we're going to be expecting a second wave to come. So the priority is that if that second wave comes, can our hospitals address that second wave? Do we have the capacity? Do we have the right number of ventilators? Do we have the resources to care for those patients? Something else I want to highlight is you can see on the bottom here, these little arrows at the bottom, and this big blue arrow, potential reversion if public health metrics worsen. Well, if we are seeing this massive second wave, and if the second wave is, God forbid, even worse than the first one that we've just kind of gone through, we may see a potential second shutdown. That is a very real threat. So it's so important to make sure we do this in a measured approach. I know everyone is eager to be in this phase 1, to be part of that first set of businesses and industries to open up. But we really need to wait our turn and do what's right. We need to do this again in a measured approach and kind of take our time to see the effects, see the numbers, make sure that no one else needs to get this virus and no one else needs to die from it. Something else that's going to be important too is something that the Governor Baker's administration talked about is mandatory safety standards for the workplace. As Mayor Arrigo said, everything you've been doing, from social distancing to wearing a mask to hand hygiene to limiting your time outside of the house, those have all been essentially the new foundation of public health in this COVID era. And that has really what's allowed our curves to look the way they look now. These mandatory safety standards for the workplace are really just building upon those foundations already. It's really about making sure that all employees have masks, that there's more hand washing stations available, that there's Purell or hand sanitizer available, that you make it so that your business can allow for people to queue up or wait 6 feet away. So we'll make sure that those things continue to happen as industries open, because we want to protect our residents, but we also want to protect the employees and make sure that they're going to work in a safe manner. And then the final piece of the puzzle to reopening is going to be testing. It's important that we have a robust capacity to test new cases, because not only will we be relying on our residents to test when it's appropriate, but we also want to be relying on our contact tracing team. They're going to be reaching out to you. They're going to be calling you to notify you that you are positive, and they're going to ask about your close contacts. And they may tell you to isolate. They may tell your close contacts to isolate. They may tell your close contacts to go for testing. So I just want to make sure, I know I mentioned this last time, but I want to make sure we don't forget to pick up the call, to answer the call. It's always better to have a few folks who are positive or high risk for being positive for COVID. You want those folks to be in quarantine or in isolation. You don't want to have to spread the quarantine order again to the whole city, to the whole state, to all these businesses that have been affected over these last 2 months. So just make sure you're vigilant about contacting your PCP, answer your phone when need be. So just kind of make sure that that is still on the forefront of your mind as we're thinking about reopening. I think that's it for the slides, Ruben. Thank you. So I want to also take a minute to remind people about testing resources. They are listed on the revere.org/coronavirus page. Our contact tracers can also guide you to testing, as can your PCP. But we also have testing for all Revere residents free of charge through the East Boston Neighborhood Health Center. That's located at Suffolk Downs. It is by appointment only, and that phone number can be found on that website. But this is going to be important as we begin to reopen, because even though you may be feeling fine now, as you reopen, as you might increase your exposure, you want to continue to be vigilant about your symptoms. You want to tell your employee that, hey, I'm not feeling great, I should probably stay home. You want to keep doing all those common sense things that you've been doing, even while we're reopening. That is still going to be so important, and it's going to contribute to us successfully reopening and staying open. We all want to stay open. We don't want another shutdown. I want to end by discussing testing for coronavirus and this idea of negative testing. So as you know, it is a nasal swab that you get to test for the virus. And it'll tell you if you do or do not have the virus at that moment in time when you're getting the swab. So you could get swabbed on a Tuesday, you can leave Suffolk Downs, and you can go to the grocery store, and literally an hour later, and you can get coronavirus then. So you can get tested on a Tuesday, you can get coronavirus on a Wednesday, all right? A negative test doesn't mean that you're immune to the virus or anything. It doesn't give you the freedom to go about in your daily life. You're still at risk for getting the coronavirus even after you've tested negative. So I just want people to know what a negative test means. And I still want you to be cautious, and I still want you to be vigilant, because every day is different. Every day brings about a new potential risk for exposure. So just continue to be vigilant, as you all have been throughout this crisis. And then antibody testing, there's a lot of talk about that. I've been getting a lot of questions from my own patients about that. So I wanted to take a minute to get that underway. Right now, we don't have any robust blood tests available for widespread use on whether or not someone has an antibody to the coronavirus. Furthermore, we don't know if having an antibody to it in your system actually protects you or gives you immunity. We think it might give folks short-term immunity, but the short answer is we don't know. There's plenty of studies ongoing. So, so right now, that's not something that we're still doing the nasal swabs. We're not doing widespread blood testing. But I still remain hopeful for progress in the areas of treatment, of antibody testing, and of vaccinations for coronavirus. So that's all I got for you today. Thank you for taking the time to listen. I think, Kate, you're up.
Hi, thank you so much for having me here. I'm really excited to talk about the mental health aspect of this virus. It's something I've gotten to see on a lot of different aspects. So at my typical job, but not Corona, I work for the Boston Emergency Services team through North Suffolk Mental Health, which is otherwise known as the BEST team. So we're the psychiatric emergency services team for the area. And with that, we've seen a lot of heightened concerns about the virus in general, anxiety and depression. And in my current role at the inn, I'm seeing a lot of concerns about just not knowing with this virus. I think people who are dealing with the virus either themselves or know people who have it, or at this point, we hear about it all the time. So it's something that's on everyone's minds daily at this point. So things like fear, worry, anxiety, depression, difficulty sleeping or concentrating are very normal. It's something that many people are feeling all the time. And as practitioners, we feel it as well. And I think that that can be difficult for a lot of people because we don't have answers. A lot of time you go see a mental health professional or a health profession, and they might have some more insight about a disease or something that's going on. But at this point, we're still trying to figure it out. So we have a lot of questions on a daily basis. And we're dealing with this in all aspects. It's not something that's affecting one group or population. So that's the same with mental health. Everyone has a type of worry that they might experience. And for some people, it becomes a bigger issue. We talk about wearing a mask outside and what it will look like when we come back to a more normal state of affairs. And in reality, it's giving a lot of people a lot of social anxiety. So what will it be like when we do go to a new normal where we are opening things up and having more freedom to go outside? So a lot of individuals are having a lot of anxiety about that in general. At the inn, we're seeing a lot of people who are all ages. So, my expectation was that we would see a lot of people of, maybe 30s to 60s plus. But our youngest patient right now is 9 months, and we have a 96-year-old. So we are seeing the entire gamut of ages. We're seeing all races, ethnicities, religions, anything you can think of, we're seeing it. And it brings up a lot of different things. People have questions about, will this continue for them? So the anxiety of that there isn't a cure right now, and there isn't an end in sight. So we're having a lot of people talking about that anxiety on a daily basis. At the inn, we have great social workers and medical people there at all times, 24 hours a day. And we're able to really talk to people. We call and check in with everybody every single day. The nurses are up in the rooms twice a day, every day. So we are getting to talk to people in isolation. But some of my concerns about the people that are at home isolating, people who are in quarantine, who don't have access to mental health professionals or doctors or nurses there with them every day. So people are having concerns about financial burdens, the inability to access food or rent, not knowing if they'll have a job to go back to. So the anxieties people are feeling are very valid and very real. And not to mention the people that are having mental health crises on a daily basis anyway. They might be suffering from different types of mental health concerns and not have the ability to see their therapist or other providers that have been really helpful to them in the past. One thing that we're noticing in general is domestic violence has been up in the country in general. Knowing that people are isolating at home and not having safe places to go is a really scary place for a lot of people to be, not being able to access supports or to get out of the house to ask for help. But there is help out there. We can help you. 311 in Revere has been absolutely amazing. I can say that being at the inn every day, I can't tell you how many times I tell my patients there the phone number of how to reach 311 in order to get food delivered to the home or to get other supplies that they need or other services. So having services available in Revere has been incredible. I can't say that for all areas in Massachusetts that have such a robust system of care. So Revere has been absolutely incredible in that manner. People are having issues with not knowing about school, work, kids don't have the structure that they were having before, which can be very burdensome on parents as well. You know, we all love our children and want to be with them as often as we can until you're with them 24 hours a day. And you realize how hard the teachers and schools and every other provider work, and that your kid is wonderful, but it's very difficult to contain. And they need a lot. You know, children obviously need to be able to go out and see their friends and play and have all these different aspects, and aren't able to access those things right now. So, you know, having Zoom education and things like that are great for when we need it, but it's really hard for children. We're seeing that at the inn right now. I'm very hands-on with our kids there. We have quite a few kids, and making sure that they're getting their education at the same time to make sure that they aren't missing out on the things that they really need to help them feel a little bit more structured. So some coping techniques that I think that can be really helpful for people is having a routine. So especially in a time of uncertainty, knowing, you know, even if you're home, to get up, take a shower, do the things that you used to do when you were going out to a job or to school, being able to shower, have a cup of coffee. Even if you aren't leaving your house or on Zoom calls all day, it gives you that different kind of a mental picture of where you are. So choosing a different place in your house to do work than you typically are can be very helpful. Same with schoolwork. Taking time off of news, as wonderful as the news is, and being able to access it. Sometimes it's too much. We tell our patients sometimes to limit how much they're watching, because you're watching the same thing over and over again. And as helpful as that information is, sometimes we need a little bit of a break from it. Making sure that you're taking time for friends, family, providers. A lot of providers are able to do their work right now. Therapy we can give on Zoom or on other social media aspects. We have NA and AA meetings that are available, and other types of supports, because we know that this is a hard time for everybody, and especially when people really rely on their communities and aren't able to have those things, it's really troublesome for people. Making sure that you're doing some fun things at home, taking time to do a puzzle or go outside, take a walk, making sure you're social distancing, of course, but doing some of those things that make you happy and give you some joy. Exercise is key. We're seeing that can be troublesome and hard for people, especially people that are in a lower socioeconomic status that might not have as much access to food. But as I was saying prior, and 311 has been a great resource for helping to deliver food to people who really need it. So there are resources out there. BEST is available 24 hours a day for people. If you are feeling like you really do need that extra support, we'll provide the information for how to access somebody to either come out or do a virtual encounter with somebody. Thank you, Ruben. So we have a lot of different resources over at North Suffolk Mental Health, such as outpatient therapy. We have recovery coaching. We have, things for children, CBHI services, which is resources for kids, therapy, therapeutic mentors. So we have availability for all those things right now. We have it in Spanish and English and a multitude of languages. So please feel free to reach out to us and we can help you. We can help manage some of the stressors that you're feeling right now. Depression, anxiety are huge at the moment, and isolation is a big thing. So we want to make sure we can help people as much as we can. I'm happy to take any questions.
Okay, we're going to.
Thank you so much, Kate.
We'll take a few questions where we'll run a little bit over 7 o'clock tonight because of the late start. One question that came in, mostly directed to Dr. Kong, and that is a concern about the safety of returning to work. Should people who have underlying health problems return to work?
Yeah, so that is a very great question, and it's definitely a personal one. Not every patient's the same. I recognize that there are a myriad of different medical conditions that you can have, and some of them might be those high-risk conditions that we worry about if you were to get coronavirus. I will say, though, that is partly why there is such a massive undertaking towards reopening the city, because we want to make sure that not only as you as a customer of a business remain safe, but first and foremost, the employees must remain safe. I don't want anyone to find themselves in a situation where they need to choose putting food on the table for their family or their health. So that is something huge. And I know Mary, I see him shaking and nodding his head. I know that is first and foremost on his mind. So part of the listening sessions and part of our reopening plan will include how do we keep employees safe? I know that there's a lot of places out there, including my own health center, where they have put up those plexiglass screens, and grocery stores, which have been essential businesses, put it the same as well. So there's a barrier against any droplets, against any kind of things of that nature. So a physical barrier that goes above and beyond the mask that those clients and those customers are already wearing. There's going to be better sanitation practices, right? Like how often is a person on their shift or at their desk, should they be working for a less period of time continuously so that we can go in and sanitize. There's most definitely going to be, mask protocols in the workplace, a lot of hand sanitizer in the workplace, and social distancing. If you work in an office, you probably won't be sitting next to the same person. You probably won't be sitting next to anybody if it were up to me. But we're going to have to really take these foundations to an extreme in every single workplace. And we're going to have to get creative and kind of, work together to find solutions so that everyone stays safe.
There's a question regarding the beach. And Mary Arrigo, you probably could address this. What are the plans for the summertime as Revere Beach becomes more of a tourist attraction? How do we keep residents safe?
Yeah, that's a great question, and that's one that we're working on pretty much every day as the weather gets nicer. We've been in constant communication with our partners at the state level around the beach and around how we can make sure that everyone has a safe summer this year. And that's why we did things like the mask giveaway a couple of weeks ago. We went down on Revere Beach. I went down myself, and we were giving out masks and just reminding people about the importance of a mask, educating people, giving them information about that and about the importance of it. And then just reminding people about social distancing. I know that there may have to be additional measures that we have to take, and we're in, like I said, in constant communication with our partners at the state level about that and about making sure that everyone can be safe. And at the same time, we want to make sure that we can, reopen. And Dr. Kong touched on it, that we certainly don't want people putting themselves at risk and making that difficult decision about, going to work or potentially putting themselves at risk or their families at risk. And that's why we have to be really responsible and measured in how we reopen. I certainly don't want to see any scenes of the beach that we may have seen the last couple of years. One of the great pictures I've seen recently has been the Sand Sculpting Festival, and you see hundreds of thousands of people down the beach. I don't think that's going to be a reality this year, and that's unfortunate. But we have to make sure that, and I have to make sure that the top priority for what we do is keeping people healthy and safe. And we're going to continue to remind folks about the importance of taking the measures that they need to. And we're going to look at every option that we can to make sure that the beach especially is a safe place.
Thank you, Mary Arrigo. This question is directed to Ms. Moore. And first, there's gratitude for the wonderful tips that you're giving. How important is exercise to cope with the stress and anxiety that comes from the pandemic?
I think it's an individual answer. I don't have an answer to kind of blanket for everybody, but we know that exercise is really great for people, that it helps with endorphins and other things that make people happy. And it also helps you to be active and not just be sitting around. It's really difficult to sit around all day. I just got back from maternity leave, so it was very hard to be at home often, as much as I love my little one. So you need to make sure that you're getting up and doing things, going for a walk or doing something in the home. There's a lot of places that you can get free exercise tips right now online, on YouTube, on TV. There's a lot of great places where you can get at-home exercise that you can do. Or if you're able to go, if you have a yard, or if you have somewhere you can go outside that you're able to socially distance. But at home, there's plenty of things you can do. It doesn't matter how big or small your apartment or home is, you can do exercises at home. And I think it's really helpful just to keep your mind going and your body going.
Thank you, Ms. Moore. Dr. Kong, a question for you regarding testing capabilities. Can anyone get tested at Suffolk Downs, at the Suffolk Downs location, or does the person have to demonstrate symptoms or have had exposure to someone who tested positive?
Nope. Anyone who desires to be tested for the coronavirus, regardless of their symptom status, can call the number on revere.org/coronavirus. It's the number to Suffolk, the East Boston Neighborhood Health Center, Suffolk Downs testing site. There's two. There's one at Suffolk Downs, but there's also another one on Paris Street. So you will receive an appointment and they'll tell you which location you should go to. So if anyone wants to go and get a nasal swab, you can, with the caveat though that, again, negative testing is just one point in time. When you get that nasal swab, it'll only tell you your status in that one point in time, but it can't predict for you what is going to happen the next day or the next week after you've gone to the grocery store or after you've returned to work. So continue to be vigilant about your symptoms. I also want to say that we are starting to encourage our contact tracers to advise on screening for the close contacts of folks who test positive. Because of the contagious nature of the virus and because we are thinking of reopening our city, I want to make sure that everyone gets tested on the earlier side, especially those who may have high risk. So those who have symptoms, those who are close contacts for a patient who is known to be COVID positive. Those are my personal priorities for testing. But truth be told, if we had an infinite number of tests, I would think it's important for everyone to get tested. So yeah, if you desire a test, you can definitely get one. But just be aware that we do have contact tracers out there, your PCPs are out there, and they'll also guide you on whether or not you should get a test.
Dr. Kong or Mayor Arrigo, this probably is something within your expertise. There are questions that people are asking about the location of positive tests and whether or not certain buildings have people. Could you explain to some extent the limitations on what the city can do in terms of alerting the public to locations of COVID-19?
Sure. We're very limited in the information that we can give out to the public, and what we've been able to do is provide folks with the numbers daily on a total macro level. Unfortunately, we can't publish numbers based on certain individual addresses, and that's just the law. And unfortunately, I know many people would like to know exactly where there are cases. And if you remember, it may have been one of these virtual town halls, we actually had a heat map at one point, and we were advised against even distributing anything like that, because it could be drilled down into individual addresses. So we are not publishing, and we do not publish individual addresses. But one thing that I think is important to note is that the law does allow for public safety to have that information shared with them. So I'll give you a kind of a for instance. When there is a positive case, our folks and the police and fire departments know, and they know if they've had contact with that household, so that we know if they need to go get tested. So we have public safety and first responder testing available, and so we need that information, and obviously our police and fire departments need that information so that they can go get tested. But sharing it publicly and widely distributing it is not allowed. And Dr. Kong, I don't know if you want to follow up on that, but it's been pretty clear cut to us.
Yeah, I think you took the words right out of my mouth. I mean, a lot of it deals with HIPAA rules too, and you want to protect patient confidentiality at all costs. So I think it stems a lot from that. So we're unfortunately limited.
Thank you both. As we're nearing the end of tonight's session, so maybe we have time for one more question, and this is a question from Ms. Moore. What advice would you give to, and you alluded to this earlier, what advice would you give to families with small children who are basically confused or worried about the circumstances?
Hey, Bob, is that question from my wife? Because we have a Kate, we have a 4-year-old and a 3-year-old at home, and I sympathize with folks who have young ones at home. And my wife is incredible. I love you. You're amazing. You're a rock, and thank you for that. But I just thought I'd throw some levity out there as well.
Well, so, I was thinking the question had to go to when I thought the question had to go to an expert, I probably should have directed it to you.
But son is too young to know what's going on so far. But I think that it depends on the age of the child, and you as a parent know your child and know what they're handle. So I think explaining to your children about what is going on. So whether that's explaining there are germs out there, we want to make sure that you stay healthy and safe. So unfortunately, we can't see grandma and grandpa right now, or things like that. I think we can explain to them, or as they get older and they're hearing the news or they're talking to friends, they might get more information. I think listening is huge. You can ask your child what they know, what they believe they know, and what they're hearing, and then giving them the correct information. With anything with children, I think giving them too much information can be overwhelming sometimes. So letting them direct the conversation and asking really what their questions are, and answering them in an age appropriate way, which might be different for your child than the next person's.
Thank you. Thank you, Ms. Moore. Mayor Arrigo has a hard stop at 7:10, so maybe we'll lead into his closing statement, and if he has to cut out, we'll still have a few moments for Dr. Kong and Ms. Moore if they want to wrap up. Mayor Arrigo, any closing statements?
Yeah, thank you, Bob. And again, I want to thank Dr. Kong and Kate for their great work on behalf of the residents of the city, and behalf of the residents all across the Commonwealth. We're all in this together, and we're going to get through it together. And we've gotten through it because of the great work and the hard work of both of you. I am encouraged. I'll end by saying that I am encouraged by some of the numbers that you saw tonight that Dr. Kong shared, and knowing that things are trending in the right way. And that's really a testament to all of the sacrifices that our residents have made, and all the things that we're doing, like social distancing and like wearing a mask and quarantining even. I know that it's been hard for us, and it's that we've all kind of been, we've all had to make sacrifices, and I certainly appreciate that as the mayor of a city that's been hard hit, but at the end of the day, we are kind of starting to see a light at the end of the tunnel. But what I want to make sure that we do is that we don't undo all this great work that people have done in terms of being socially distant, in terms of wearing a mask, in terms of stopping the spread of this virus. And we would undo it if we weren't responsible in how we reopen. We would undo it if we were not smart about how we move forward and continue a lot of the great momentum that we had going into the beginning of this year. So I want to make sure that people know that we have to be slow, we have to be deliberate, and we will continue to monitor the data as Dr. Kong alluded to. And that's all important because we're not going to get a second chance at doing this right. And it's really, really important that we do this right. So I want to end by thanking everyone who's watching, and thank you for the sacrifices that you've all made. And I certainly appreciate it. I know everyone on this Zoom appreciates the sacrifices that people have made in the city. And thank you for tuning in.
Dr. Kong, if the mayor does have to leave, do you have a few moments just to answer a couple of questions that just came in
Sure.
that are pertinent to the medical field. And one of them deals specifically with the dental profession. Where do dentists stand in all of this, and will they be able to stay open?
Yeah, so at this point, I don't know the granular details on what is going to be included in phase one. What are going to be those first industries that are allowed to be opened? I imagine that, obviously the places that have stayed open throughout all this, like the essential businesses, the pharmacies, the healthcare centers, the clinics, the grocery stores, those will remain open. They may continue to have to reduce their capacity, but we might start to loosen that up. But in terms of dentists, I don't know where exactly they fit in phase 1, 2, or 3. They will be allowed to reopen, but just like the health sector, we're having to reimagine what our waiting rooms look like. My clinic, we're trying to figure out, how do we open our office again to seeing patients, but how do we have patients sit in a waiting room 6 feet apart? So there's going to be a lot of changes and a lot of opportunities to be creative and to problem solve around this. And that's something that we're all going to have to do, dentists alike. For dentists in particular, more so than other places, is going to be hygiene and masks, again, because they're interacting with patients. So we want to make sure they're at the same standards as I'd say in any other clinic, and that is to protect your employees, but also your patients. So make sure that that you're sourcing your usual surgical masks and whatnot, maybe face shields, things like that, hand sanitizers, hand washing stations. Obviously, when you're seeing a patient, you can't socially distance, and I can relate to that as a primary care doctor. But make sure your patients are 6 feet away, and make sure they're 6 feet away from your secretary at checkout. So same rules apply, but again, there's just going to be a lot of opportunities for creativity and for problem solving. No one industry is going to be alike in the way they maneuver these issues, and no one dentist office is going to be alike too. Every dentist office is going to be different in terms of their square footage. So we're all going to have to tailor our approach to our own personal businesses in addition to just each sector.
Thank you, Dr. Kong. And while you're speaking, do you have any final words that you want to wrap up with? And if not, I'll ask the same question, Ms. Moore.
Yeah, so I'll just wrap up by echoing a lot of what the mayor said. In order for us to get this right, in order for us to prevent a second shutdown, we really have to be methodical about this. I know everyone on this call, everyone in the city, everyone in the country, they've really gone through such tremendous sacrifices over the last 2 months. And, it feels unfair that we're asking you guys to continue the sacrifice for even a day longer, but that's really what it's going to take. We're all in this together, and we all have a role to play. So we all just have to kind of be in this together and continue to do so, and try to, take this slow, take this one day at a time, and make sure we do this right. I don't want to undo all the progress we've made, all of the people who have really risen to the occasion. I don't want to make their work all for naught either, and I don't want to make everyone who had the coronavirus and recovered from it, I don't want to give it to them again. So these are all the things I think about, and I just want everyone to know that we really have to take this one day at a time, but there is a light at the end of the tunnel, and hopefully we can get back to our new normal as soon as possible with as few new cases as possible.
Thank you, Doctor. And Kate, would you like to introduce us to your co-host there?
Yes, this is my co-host, Isaiah. He's 5 months old. And as you can see, working from home can be quite difficult at times. We can't always, determine what's going to happen from moment to moment. And I think it's just a good lesson in life that we have to sometimes go with the flow and realize that this is a different time, but we are going to get through it, just as the doctor just said. And we got to take care of each other. We got to make sure that we're reaching out for support when we need it, that we're really able to appreciate the things like having some extra time with our little ones, even if sometimes they are a lot of work. We know that we get to spend this time with them because we won't always have that. As you can see, Isaiah's a little bit more interested in maybe having some mommy time right now.
That's completely understandable. Well, Thank you to Mayor Arrigo, Dr. Kong, and Kate Moore. That concludes tonight's virtual town hall meeting. Everyone is reminded that the City of Revere website, www.revere.org, contains comprehensive and up-to-date information about the pandemic and resources that are available to Revere residents. Residents are also encouraged and reminded to call Revere 311 with any questions. That concludes tonight's session. Stay safe, everyone. Thank you.